Before engaging in an exercise program, an individual needs to be assessed on their overall physical fitness before being prescribed a workout program. Depending on an individual's risk classification for CHD, they may be subjected to a submaximal test such as the YMCA Submax Cycloergometer Test. This YMCA Submax Test is assessing an individual's VO2 max, which allows us to directly determine their aerobic fitness. Cardiorespiratory endurance is a major component of someone's overall physical fitness, so it will give the exercise specialist an understanding of how fit the individual is and will be able to create a prescription based on the individual's current physical fitness. Improving cardiorespiratory endurance has many benefits, but is indirectly related to disease risk. As cardiorespiratory endurance improves, the risk for cardiovascular disease decreases.
The participant for our test is Erica Nolman. She is a junior exercise science major and is a college athlete. She is 21 years old, weighs 136.3 pounds, and is 66 inches tall. Her resting heart rate is 71 beats per minute, and her resting blood pressure is 100/60.
The testing administrators for this test are Melissa Hammer and Jill O'Hara. Melissa is responsible for assessing heart rate, and Jill is responsible for assessing blood pressure and increasing the resistance at the beginning of each new stage. We will be obtaining heart rate and blood pressure measurements throughout a bout of submaximal exercise and using the proper data obtained to plot on a graph to give us an estimate of the subject's absolute VO2 max.
We began the test by assessing Erica's resting heart rate and blood pressure.
The purpose of this protocol is to perform a bout of exercise at a submaximal level that significantly raises the individual's heart rate and blood pressure in order to estimate the individual's VO2 max.
We then adjusted the seat height for Erica. We had Erica stand next to the seat of the cycle for reference. The seat height should be raised or lowered to the level of the participant's hip bone. Once we had the seat set, we had Erica sit on the bike with her feet on the pedals. There should be a slight bend in the knee when the pedal is at the lowest part of the cycle.
Have the participant warm up on the cycle ergometer for 2 minutes while the testing administrators prepare for the beginning of the protocol.
To begin the protocol, refer to the protocol chart. For this test, Erica will cycle at a constant cadence of 50 reps per minute. Depending on her heart rate measurements obtained during the workout, Erica will proceed through a series of stages that include increases in workload. These workloads are increased by a change in resistance. Each stage is 3 minutes long, and in each stage, 2 heart rate measurements and 1 blood pressure measurement will be obtained. In order for the test to proceed to the next stage, a steady state heart rate must first be met. If a steady state heart rate has not been met, the stage will continue an additional minute until a steady state heart rate can be obtained. The test may be terminated when there are 2 consecutive stages that have an end stage heart rate reading between 110 beats per minute and 150 beats per minute.
For the first stage, Erica cycles at a workload of 25 watts. Broken down, this means she is cycling at 50 RPM with a 6-meter distance on the flywheel and at a 0.5 kilogram resistance. Mel waits to take the first heart rate measurement until Erica has been cycling for 1 minute at 40 seconds to allow for time for Erica to adjust to the workload intensity. After the first heart rate reading, Mel measures Erica's heart rate every minute after the first reading up until the end of the test. This allows for at least 2 heart rate readings for each stage. Jill obtains 1 blood pressure measurement in the second minute of each stage Erica performs.
A steady state heart rate was reached during the first stage, so Erica moved up to the second stage in the test. Based on Erica's end stage heart rate for the first stage, 84 beats per minute, we follow the remainder of the test stages down the second column from the left because her heart rate fell between 80 and 89 beats per minute. For the second stage, an increased resistance to 2.0 kilograms increases Erica's workload to 100 watts. This stage was performed in 3 minutes and a steady state heart rate was obtained.
At the end of stage 2, Erica had reached a steady state heart rate, allowing her to proceed to the third stage. An addition of 0.5 kilograms increased the resistance to 2.5 kilograms and a workload of 125 watts. At the end of the 3-minute mark, Erica had not yet reached a steady-state heart rate, so the test proceeded an additional minute until a steady-state heart rate could be achieved. The third stage took 4 minutes in duration and was performed at a workload of 125 watts. Erica's heart rate readings were 114 beats per minute, 126 beats per minute, and 132 beats per minute. Her blood pressure was 126/60, and her reported RPE was 15.
Since we did not acquire two end-stage heart rates in both the second and third stages, Erica continued on to the fourth stage in order to obtain a second end-stage heart rate that fell in between 110 and 150 beats per minute. The fourth stage was performed at 3.0 kilograms of resistance times a 6-meter flywheel distance and a cadence of 50 reps per minute for a workload of 150 watts. To fully understand the values acquired from the test, we plug them into a line graph that can help us estimate an absolute VO2 max value. In order to graph the data properly, there needs to be two end-stage heart rate values that fall between 110 and 150 beats per minute. These two heart rate values will be the data points for the line graph. If only one heart rate value falls between that range, another stage is required before the graph can be properly plotted. Calculate the participant's age-predicted heart rate max by subtracting their age from 220. Erica's heart rate max is 199 beats per minute. Find this heart rate value on the y-axis and draw a horizontal line across this value. Calculate the workloads for both stages that correspond with the end-stage heart rate. Workload is calculated by multiplying the amount of resistance times the distance on the flywheel times the cadence the exercise was performed. For Erica's first data point, the x and y intercepts are 750 and 132. For the second data point, the x and y intercepts are 900 and 146. The workload is viewed as the x-intercept, while the end-stage heart rate measurement is viewed as the y-intercept. Using these values, plot the data points for both stages used. Once both data points are plotted on the graph, use a straight edge to draw a line that goes directly through each point and is extended until it reaches and passes the horizontal line at the age-predicted heart rate max. At the point on the x-axis where the diagonal line from the data points intersects with the heart rate max, draw the vertical line that goes down until the x-axis is reached. The value on the x-axis that the line is drawn to is the estimated absolute VO2 max. In this case, Erica has an absolute estimated VO2 max of 3.4 liters per minute. Finally, convert the estimated VO2 max value from absolute into relative by multiplying it by 1,000 to convert liters to milliliters, and then dividing the subject's body weight in kilograms. Erica's estimated relative VO2 max would be 54.8 milliliters per kilogram per minute.
Common testing-related issues include misinterpreting how to perform the protocol, an inability to obtain a blood pressure reading or heart rate reading efficiently within each stage, not knowing when the subject has completed the appropriate amount of stages in the protocol in order to acquire sufficient amount of data, or graphing the wrong data. Once Erica achieved a steady-state heart rate between 110 and 150 beats per minute for 2 consecutive stages, she began a 3-minute cooldown. During the cooldown, resistance should be lowered and vitals should be taken once more. Erica's final vitals included a heart rate of 92 beats per minute and blood pressure of 112/66.
Before performing this protocol, thoroughly read through the procedures more than once to truly grasp how to perform it. Walk through the protocol before performing it, and practice assessing heart rate and blood pressure multiple times while someone is exercising in order to become efficient in obtaining data.